From the discovery of the polio vaccine to breakthroughs in organ transplantation, the city of Pittsburgh has been at the forefront of countless medical innovations that have changed the course of medicine forever. Today, bridging the gap for patients waiting for a liver transplant, an innovative and life-saving new option. I'm Ereka. Access Health starts now. Pittsburgh, Pennsylvania is home to UPMC, where their living donor liver transplant program is a game changer for patients with end-stage liver disease. Nationwide, 30 million Americans have some form of a liver disease, and 14,000 people are on a waiting list for a new liver. But only 5,000 of deceased donors' livers are available for transplant, which means 2,800 lives are lost each year waiting on the list. Dr. Abhinav Humar, chief of UPMC's Transplant Services, wants to change that.
Here at UPMC, we believe that live donor liver transplant should be the first option for patients who need a liver transplant. It's one of your essential organs. If your liver stops working, essentially you can't survive. At the present time, liver transplantation really represents the gold standard treatment for anyone with end-stage liver disease. Of all the liver transplants that are done, about 95%, 96% come from a deceased donor, and about 4% come from a live donor. So the proportion is very small. At our program, it's actually the other way around. In fact, last year we did more live donor liver transplants than we did deceased donor transplants. There are a multitude of causes of liver failure in this country. Unfortunately, liver disease can affect any segment of the population from essentially newborn to well into the end stages of life. The most common causes that we see in adults are things such as hepatitis C, hepatitis B, fatty liver disease, alcohol, and various other things such as autoimmune disorders, something called primary biliary cirrhosis, primary sclerosing cholangitis. Once the liver fails and develops, it essentially behaves the same regardless of what essentially caused it. Initially, patients have what we call compensated liver disease. That means that their body is able to compensate. So even though they have liver disease, they have minimal symptoms because their body is able to manage that. But at some point, as the liver function continues to deteriorate, they develop what we call decompensated liver disease. And that means that the liver is no longer able to do the basic day-to-day type of function, and therefore people start developing symptoms. And the most common symptoms of end-stage liver disease are things such as fluid buildup, especially in the abdomen, episodes of confusion and disorientation because the liver is not able to clear toxins from the blood, and things such as muscle wasting, fatigue, and then eventually failure of other organs, especially the kidney, because all organs are tied to the liver in one way or the other.
I'm here outside of Pittsburgh to meet with Frank True, whose life was saved thanks to UPMC's Living Donor Program.
Worked for the FBI. I started with the FBI in 1980 in Newark, New Jersey, and was then transferred over to New York City. And then in 1987, I switched over to the Drug Enforcement Administration.
What do you love about your job?
You just feel like you're contributing, you're doing something to hopefully help America.
When did you meet your wife?
I met her in high school.
In high school, sweethearts.
I met her in high school.
And when did the kids come along?
My son, Sean, was born in 1987. My middle child, Ereka, was born in 1991. And my youngest daughter, Shannon, she was born in 97. And I have my grandchild, Frankie.
So in your line of work, I'd imagine you'd have to be pretty healthy.
I was always in shape, and then I was transferred in the DEA to Quantico, Virginia, to train basic agents. And I was a physical trainer, PT instructor. I was working out every day, taking recruits out.
When did things start to change for you?
In 2001, I was transferred here to Pittsburgh. And around 2005, January, I started getting a pain in my back. And I was on the floor pretty much the whole day, this one Saturday in particular. And after, 7 hours of just hoping it would go away, it never did. I went to the hospital and they just said, you got to follow up with your doctor. You may have pulled a muscle. So I followed up with my doctor, and then she called me in a panic and said, you have to go to the Center for Liver Disease at UPMC right away. So I rushed up there, and I take a battery test, and they come back and they tell me that you have what is called primary biliary sclerosis. And he said, 10 years you're going to need a liver transplant.
Once it's determined the liver function is affected, the patient should be evaluated by a hepatologist who specializes in liver disease.
Cirrhosis can be an insidious condition that can be sometimes difficult to diagnose and pick up, especially in its early stages, because they're really very minimal symptoms. And so many patients can go many, many years without any problems associated with the liver, even though they have cirrhosis. And it's only when the liver disease gets to the point of decompensation, what we call end-stage liver disease, that they then start presenting with the symptoms.
Things can be done to prevent a patient's status from advancing.
Once a patient is diagnosed with liver disease or suspects they have liver disease, they can certainly do things to try to prolong the length of time that they stay in that stage of compensated cirrhosis. And that includes eating a well-balanced nutritional diet, eating a diet that's more plant-based as opposed to meat-based, obviously avoiding alcohol and addressing those medical issues, high cholesterol, high glucose, excess weight. And then beyond that, then it's just a matter of regular follow-up visits and regular screening to see what the course is of the liver disease progressing and to make sure that no other secondary complications such as liver cancer are developing in that cirrhotic liver.
In 10 years, you need a liver transplant. And at that point, what did you think? Okay.
Yeah, sure. You know, I'm in good shape. I'll beat this too. You know, and I didn't, but that was my attitude. I'll beat this. You know, I'll just watch what I eat, watch what I do.
So at what point did you realize that you weren't going to outrun this?
2015, and it was the Monday before Thanksgiving. All day I wasn't feeling right, and he took me right over to UPMC for what I thought was just a routine banding now, which I had done before. I had these varices, and I have them in my esophagus. That particular day, one broke. Just thinking I'll be awake in 20 minutes and everything will be okay. I woke up 4 days later, and on Thanksgiving Day, they put me in a self-induced coma because I had bled so much that they had to get all the blood out of me. And I probably dropped 10 pounds, 15 pounds in those 4 days. Finally, I realized, all right, this was a lot worse than I thought. I'm a lot weaker. After everything finally got settled, Dr. Rabinovich had said to me, you really have to find a living donor. You know, think about a living donor.
Coming up, how patients are the inspiration of the Living Donor Program at UPMC. And later, we'll hear from Frank and how a selfless act changed his life. Stay with us. UPMC is giving patients an innovative option to treat their end-stage liver disease with the goal to completely eradicate the need for a liver waitlist.
The liver is the only organ which can regenerate in around 8 to 12 weeks, both in the donor and also the recipient. And that's why living donation is possible while someone is alive and they can donate and still live a full, healthy life. At UPMC, we believe in early referral to transplant because we know and understand that early transplant offers them the best outcome. When they initially get diagnosed with cirrhosis and we approach the topic of transplant, we understand how emotional it could be and shocking. We take the time and educate them about liver transplant. We say to them that we are partner in care with you and we walk this journey with you.
Frank knew a transplant was his only option for survival, but as a tough DEA agent, he didn't want to ask his family for help. The concept of living donor a transplant, though,
right.
That's relatively new. Usually,
yes.
The majority of the people who need a liver transplant wait for someone to die.
Correct.
Were you on that list as well?
I was, but I wasn't. I know I never got there. And I know there were other people with probably worse cases than me that needed a liver badly. So I wasn't too hopeful about that.
So then what were you doing? So now you think it's fated. I'm done. Right. I have this, it's going to be, there's an end in sight. Right. What was your reaction with your family?
I had written them all letters to each one member of my family, telling them how I felt about them.
Did you think about asking your family?
I thought about, from a match perspective, but I just didn't want to ask. I didn't want to ask.
So your children stepped up and said,
yeah,
you can have
yes,
part of my liver.
They did. My daughter Ereka, my oldest daughter.
And she was a match.
Yes, she was.
The eligibility to be a donor requires good physical and mental health, as well as a history of no major diseases.
We expect the donors to be between the ages of 18 to 55. We expect them not to have any chronic medical illnesses or active cancer or HIV, and no substance abuse. And we also expect them to be in good physical condition as well as good psychosocial conditions. The donors have to do this willingly and altruistically without any pressure.
Because we have a limited resource, i.e. the deceased donor transplant liver, there has to be a priority system that the ones who are in most dire need are the ones who are going to get it. One of the ways that we can quantify how severe someone's liver disease is something called the MELD score. The MELD score stands for Model for End-Stage Liver Disease. The MELD score is a mathematical formula that helps us to quantify how severe someone's liver disease is. Generally, once a patient is above 10, they're getting symptomatic liver disease. Once they reach 15, they're definitely ready for a transplant. At 20, they're generally pretty sick. 25 is really quite ill. And 30 and plus, where the MELD caps out at 40, they're critically ill, needing a transplant within weeks. When a liver becomes available from a deceased donor, the person who gets the liver is the one who has the highest MELD score, who presumably has the most severe form of liver disease at that time.
Living donation not only offers improved outcomes for recipients, but can also help save the 1 in 5 people likely to die on the transplant waiting list.
In our mind at UPMC, we think about living donor as the first option to all the patients on the wait list, and we offer living donor liver transplant as a choice. With a living donor, you can time the surgery when the patient is feeling at their best. And the outcomes are also better because they are getting the surgery when their MELD is on the lower side. And the reason why we are very passionate about living donor is when you have a living donor surgery, that person can save 2 lives, meaning that person is saving the person on the wait list, and that opens up the other person to get the deceased donor organs.
A transplant essentially involved. It's a major operation, a major impact on the system. And you're obviously going to be more likely to be able to recover from that major stress if you're in better health to begin with. And so therefore, live donor transplant offers that as an advantage, that we're able to transplant the patients when they're relatively healthier. We don't actually even look at the MELD score when we're thinking about a live donor transplant. If someone has a live donor transplant as an option, we essentially see, do they have liver disease? Do they have decompensated liver disease? Are they going to get a survival benefit with the transplant? And if the answer is yes to those questions and they have a suitable living donor, then we feel it's appropriate to move forward with a transplant.
Up next, more with Frank and Ereka, and later we'll learn about UPMC's approach to finding donor matches through a one-of-a-kind champion program. Ereka, thank you so much for joining us. I've heard so much about you. You're a nurse. Tell me a little bit about that.
I'm an oncology nurse, so I deal primarily with a lot of leukemia and lymphoma patients, and I love what I do.
So I'm going to take you back to the day when your father had his episode and was bleeding. Mm-hmm. What went through your mind at this point?
Like I knew, like it just wasn't good. And I said to my mom, I'll donate to Dad. And she said, no. And it was just shut down.
Yes.
By my mom and my dad, like instantly. I just think really all of us lacked education on being a living donor. I just said, I'm going to get tested. I'll see what my blood type is. And I was a match for my blood.
And so then when did you fight back and say, hey?
After the living donor workshop. It's either this or, he dies.
UPMC created the Living Donor Champion program, which is designed to help patients identify a champion who provides support in finding a donor so the patient can focus on their health.
At UPMC, we put together a champion program with our team. Anyone could be a champion, but the champion should partner with the recipient and advocate for the recipient to find a donor for them. The champion could be anyone from their support group, it could be their caregiver, it could be anyone in their neighborhood or the cousin. We empower the champion with multiple resources and help them utilize them effectively as well. There are several resources which we offer to them, starting from a Living Donor Champion Toolkit. And we also offer the Champion Toolkit advice or suggestions through our town hall meetings. We also have group discussions, we have one-on-one education sessions, and we also have champion workshops.
Frank's wife, Debbie, is the anchor of the Drew family. You did not want your children to be donors.
No, not at all. I was too afraid.
So what changed your mind?
It was the champion workshop that changed my mind. And that day I was educated on, listening to donors, and Dr. Ganesh was the one that totally changed my mind. I said to her, my daughter's married, only 4 years, she and her husband don't have children, and I was fearful that something could happen or she wouldn't be able to have children someday. And she said no, she could have children, and here we are, having a baby. I knew that everything was going to be good.
As patients navigate the emotional landscape of finding out they need a liver transplant, the hope is that this new standard of care will help the nearly 2,800 lives that are lost a year while waiting on the transplant list.
At UPMC, we have an entire transplant team dedicated to both the recipients and donors to coordinate all aspects of transplant process, both pre and post transplant. They have a whole day of testing done, and during that day they get to meet all of us individually. We talk to them about the medical risks, surgical risks, and we also follow them very closely post-donation in the clinic.
As expected, emotions ran high on surgery day, but for Ereka, this selfless act was the least she could do for the father that has given so much to her.
I'm worried about her. I'm not worried about myself. I mean, whatever happens, happens.
And so what's going through your head at this point?
I have a good faith, like I'm gonna be okay. This is what, I feel like this is what I was supposed to be doing. Like I'm here for a reason.
And they took her in first, and we hugged each other. Said I'd see you later.
It was a success. Yay!
It was.
You were here and you look great.
Thank you.
Do you feel good?
I feel real good. I feel real good. Like I haven't felt for 15 years. Prior, when you're sick, you're disoriented, you're not clear. But after, as soon as I had my daughter's liver, I was like looking at everything. I was just so aware, and I wanted to get out of bed. I mean, you're hooked up, but you just felt so different. You felt
like you were
felt
healing.
like alive again.
It's incredible to think that 60% of your liver is now inside of you.
Now mine.
Is now yours.
Mm-hmm. Right.
Truly a part of you is now inside of your father.
Frank and Ereka received their transplant some months ago, and happily both are doing very well. And they're really a very good example of the advantages and the benefits that living donor transplants can offer. We strongly believe and are passionate about the fact that this should be made available to all patients so that they can have that option, they can have that ability to benefit from it.
Living donor liver transplant is a life-changing option for these patients. Living donation should be offered as the first option to all the patients. And it's time to change the paradigm to living donation, and for people to think about living donation, the education is the way to go. And we started that already at UPMC. And hopefully, surely, soon, we are going to close the bridge, and we are going to probably do more and more living donor liver transplants in the country.
It's been an amazing journey, and we've been blessed to have such wonderful doctors and staff at UPMC. I mean, we really have been. And a year ago this time, my husband was dying. He could barely get out of his car when he came home from work. But now it's great. He's back to his old self, and his sarcastic sense of humor. Yeah, it's good. And I would say that anyone that's considering being a living donor, do it. Save a life. It's an amazing thing, an amazing journey.
I want to thank the Drew family for sharing their story, UPMC for educating us, and of course, big thanks to the courageous organ donors who are giving people a second chance at life. To learn more about the benefits and risks for living donor liver transplant, please visit upmc.com, and for more information, log on to accesshealth.tv.